Backed by popular demand, our next speaker is Dr. Matt Wilkinson. Dr. Wilkinson is a transplant surgeon at St. Luke's Health System and moved to Kansas City in 2019. He has a passion for transplants and a deep respect for organ donors and organ recipients. When operating on an organ donor or an organ recipient, Dr. Wilkinson makes a special time with the entire staff to show appreciation and acknowledgement of the life of the donor and the special gift that be received by the recipient. When he isn't working, he enjoys traveling with his husband Marco, taking care of his saltwater fish tank, and playing with his 3 cats, Tiger, Luna, and Gigi. After Dr. Wilkinson concludes, it will be time for a few questions. Please welcome Dr. Matt Wilkinson.
All right, good morning. Thank you for that very kind introduction. Since last year, we have picked up another cat, so now there are 4. But other than that, it's very nice to see you all this morning. I am a transplant surgeon at St. Luke's. I also am a hepatobiliary surgeon, which means I do surgeries on people's livers and their pancreases and their bile ducts if they have cancer or other concerns in those areas. So what I'd like to talk to you about first is how you get to do kind of the job that I do. So let's take a look at the next slide. So I was born in 1983. I know for you guys in the front, that's probably a long time ago. You've never thought of people in the back. That might be more recent than you want to admit. We lived there for about 6 years, and then we moved to Connecticut for 2 years, and then we moved to South Carolina, which is where I grew up. I graduated high school in 2001, so that was in this century. And I did 4 years of undergrad at the University of South Carolina. So if you want to go to medical school, you have to do an undergraduate degree first, which is usually a 4-year degree, which is what I did. I then went to Texas, I moved to Dallas, and I actually started a combined program. So I went to school to do an MD and a PhD. So an MD is a medical degree, which is what you want to do if you want to be a physician. A PhD is a research degree, and you can do combined programs. So I started there, I was there for 3 years, and then my PhD mentor moved to New York. So I moved to New York City and lived there for 4 years, finished both of those degrees, and then did my residency. So when you do medical school, you learn about all the different fields of medicine. You get to try everything: internal medicine, surgery, psychiatry, pediatrics. And then you make a decision about the kind of medicine you want to practice, and you do more specialized training in that field. And so for surgery, which is what I did, that's another 5 years. So I stayed at Mount Sinai for another 5 years and did general surgery. And transplant is a special field within that, so that's another 2 years of training afterwards, which I did at the hospital at the University of Pennsylvania. So if you've added that up, that's 18 years of training after I graduated from high school. Then I came here, and I've been here since 2019. I came here in December at the end of that year, and I've been working at St. Luke's since that time. So they gave you the number already, but this is an important fact to know. How many people are waiting for a transplant? And this is just in the US. This is not worldwide. This is not if we looked everywhere that people get organ transplants. But in the US alone, there's about 100,000 people waiting for a transplant at any one time. What organ do you think, well, what organs can you transplant? First of all, call them out. What organs can you transplant? You've just heard about one, so that's easy. The liver, right? You can do a liver transplant. What else? Kidneys. Heart. Lungs. Pancreas. Yep. You can do, and then they told you about tissue transplants, right? You just got heard about different things in eyes, things like that. Bones and connective tissues. Skin grafts, so all of those things can be transplanted. For solid organ transplants, which are the big organs, there's about 103,000 people waiting. Now, how many people do you think everybody gets a transplant? No, some people die before they get a transplant, right? In fact, if you had to start dialysis this year, so dialysis is the procedure you get if your kidneys don't work. That's where people have to go into a center, they get their blood taken out, the blood gets cleaned and gets put back into their body. If you start dialysis this year, everyone in this country that starts dialysis, how many of them do you think are going to be alive in 5 years? What percentage? 20%. That'd be really low. It's about 50%. 50% of people will die 5 years after starting dialysis. So again, if you don't have an organ to give them, these people are going to die from their underlying diseases. And so that's the reason to do a transplant. How many people do you think die each day waiting for a transplant?
17.
17! Oh, look at that. good. You guys can read. I can read too. That's good. All right, perfect. If we look on the next slide, what we can see is what organs people are waiting for. And you can see kidney is by far the most common. Okay, so kidney is by far the most common transplant that we do in this country, and they're the most people waiting, about 90,000. And about 25,000 kidney transplants are done each year. It goes down after that. Liver is the next most common, followed by heart, lung, and then others. And under others, there's actually a lot of different things. That's going to include things that are more experimental at this point. They've actually proven that you can do uterus transplants. So for women that are either born without uterus or have problems with the uterus that want to have children, they've been able to transplant the uterus, and then they've actually been able to have children from that. Those are things like people who get face transplants. So people, if they've had some bad, like a dog attack their face, they had some other damage to their face. So those are called visceral composite allografts. They're called VCAs. That's a very complicated name. But it basically just means other pieces of tissue that's not a solid organ. Go ahead to the next slide. So this is a picture in the operating room, and what you can see there, that's me on the left, and that's one of my mentors on the right. When we do this, all these connections are very small, because you can't just open the person up and throw the organ in and hope that it works okay. Super glue is not going to work very well for that. You have to reconnect all the blood vessels. And some of the organs, you have to take the old one out first. So when we do a liver transplant, the old liver has to be taken out first. So there's a whole operation before you put in the new liver. With a kidney transplant, you don't take the old kidneys out. You don't even put the new kidney in the same place. The kidney doesn't care where it is as long as it's connected to the right things. So what we wear on our faces to see those, you can see those glasses, they have little telescopes inside them. And those will expand your vision about 2.5 to 3.5 times depending on how big they are. So we're looking down these little tiny telescopes that we wear in order to be able to see these very, very fine connections that we're making. If you think about how like clothes are stitched together, the threads on your clothes, the sutures we're using are even smaller than that, to sew the arteries and the veins back together. On the left, that is a picture of a human kidney that's ready to be implanted, basically. The kidney itself, you can see it looks sort of like a piece of chicken breast you might get in the grocery store. When the blood goes back into it, it'll turn bright pink. It's one of the coolest things you've ever seen. Within about 2 seconds, that thing, when the blood goes into it, is going to turn bright pink and start working. A picture of a human's on the left. You can see the kidneys that you're born with. If you feel for your bottom rib, you have 12 ribs. Your bottom one, that's where your kidneys are that you were born with. Your bladder's down here. They connect all the way down, but we don't put the new kidney there. In fact, we don't take the old kidneys out. The new kidney actually gets put in the lower abdomen. You can do it on the right, you can do it on the left. If you really get confused, you can put the kidney in upside down. The kidney itself doesn't actually care. You connect it into the blood vessels that go into the leg. You put it on the side, so some of the blood can still go in the leg, some can go into the kidney. And then you connect the ureter tube. The ureter is the tube that carries urine from the kidney to the bladder. And sometimes, if it's a really good kidney, it'll start making urine and spitting urine out that tube before you can even plug it into the bladder. It'll start right away trying to make urine. The kidney doesn't care where it is. If it is blood supply, it's going to try to filter that blood. So that's what a kidney looks like. You could probably, if you open your hand, that's about the size of a human kidney. They're usually about 9 to 15 centimeters, depending on how big you are. Your kidneys weigh about 1 pound each. So you have 2 pounds. Your brain weighs about 3 pounds. But those 3 organs, 2 kidneys and a brain, get 50% of the blood that your heart puts out. So they're very, very important organs that you deal with. Your liver is a little different. So your liver is your biggest internal organ. It's bigger on the right side. When I draw pictures for patients, I tell them it's just a big triangle. That's all it is. It's that big brown triangle. Okay? It has some important functions, but that's all it is. To do a liver transplant, you have to take the old liver out first. So the first half of the operation is really just getting that liver freed up. And again, it's not a healthy liver. People get liver transplants because their livers get sick, and that could be because they drank too much, so alcoholic liver disease, because they got an infection, hepatitis. One of the most common reasons that we actually transplant nowadays is because people get what's called fatty liver. And having too much fat in your liver can actually make your liver scar and die. And that's the end stage of liver disease called cirrhosis. And that's when you have to talk about needing a transplant. So when you take the liver out, you put the new one in. So when I tell patients about it, I say it's sort of like changing an engine block. You have to, take the old one out, lift it out, and then put the new one in. It's a little more complicated than that, but the same. It's different with this one. This is called an orthotopic transplant because the organ goes in the same place. That's what a liver looks like. That's one that's about to be implanted. So you can see the right side of the liver is a little bit bigger than the left side. That's the normal color for a liver to look when it has blood in it. When the blood's not in it, it'll look a little bit brown. And that's a normal liver. You can see that it has smooth edges. Those edges are sharp. When livers get sick, they get kind of knobbly, they get scarred, and they get lumpy, bumpy on the surface. So that's what I do most of the day. Some new things that we're interested in is normally if someone becomes an organ donor and they donate their organs, we do a surgery to take those organs out, so I still do that surgery. So there's a surgery to take the organs out of the donor first, so that's another part of my job. And when you do that, you take the organs out of the donor and you put them on ice, because if you left them warm, they would start to degrade and break down before you could put them in the new person. And so that's putting them on ice is what we do for a period of time. They're now making machines where you can try and keep them warm the whole time, which hopefully should minimize how much damage is caused to them by making them cold and then warm. As you may have also read in the news, they're working on engineering organs. Two of the biggest issues in organ transplantation. Why don't we transplant everybody? Because there aren't enough organs, right? That's why people die on the waiting list. We don't have enough. And then if you get an organ from someone else, your immune system may attack it, right? Your immune system says, I wasn't born with that organ, and choose to attack it. The medical word for that is rejection. Someone who gets an organ transplant has to take medicine every day for the rest of their life to prevent their immune system from attacking that organ, and that could put them at risk for other complications. But they're working now to engineer organs. So like taking a cell from your own cheek, turning it back into a stem cell, which is the cells that can turn into anything, and then make them turn into liver cells, or kidney cells, or the kind of cells you would need for an organ. If you did that, since the cells came from you, you wouldn't need to take immunosuppression, which would remove one of the largest barriers in transplantation. You may have also seen in the news, the University of Maryland has done 2 of them now, where they've taken hearts from a pig and put them in humans to see how they can work. They've basically taken some of the markers off the surface of the heart cells that say, I belong to a pig, not a human, so that the human's immune system doesn't attack it. And again, that would also alleviate some of the organ shortage, because you have the ability to source those organs or get them as opposed to having to take them from other people. You can do living donor transplants, right? So kidneys, you have 2 kidneys, you can donate 1 kidney if you're otherwise healthy and give it to someone. You have to undergo a surgery to do that. You can also actually take out a piece of someone's liver and use it, because the liver is the only organ that regenerates. So if you take out a liver, that piece of liver is going to grow to the right size in the person you put it in, but it's also going to grow back in the person you took it out of. So it's going to work for both. You can't do that with hearts and lungs, unfortunately. They don't regenerate. You can't take out a piece of them. You need all of those. The biggest thing I think that's important is no matter what you choose to do in your life, be passionate about it. That's number one. I didn't know what I was going to do when I was at your age. I thought I might go into medicine, but I wasn't sure about that. I did my PhD in neuroscience. I thought I was going to be a psychiatrist. So that didn't work out very well. Just be passionate about whatever you choose to do. Don't do something because someone else tells you to. Do it because you enjoy it, because you like what you do. And then the other important thing to talk about at the beginning is be an eye, organ, and tissue donor. The best way for people to be able to get transplants, you never know if you're going to need a transplant until you need one. So being an organ donor, signing up to be an organ donor is an important thing. All right, well, it's nice to talk to you.